Video I am again discussing a recall communication that is a medical error or medicine error. It is common 2018. The task was there speak to the mother of a child with CROP who had 10 times the prescribed dose of dexamethasone given by a senior sister. So we will apply to it in about 4 seconds. Explain error immediately. I said that this is a very unlikely to cause any significant long or short term effects to the child, but would need to stay into monitor well-being and blood sugar levels. Mom was angry and repeatedly stated that it was not good enough and that she could never trust the service again. Talked about the consulting national database for guidance, adverse incident processes, individual and team feedback. Apologized about 1,000 times and explained we try very hard to limit the accidents, but it is impossible to eradicate completely due to human error. Talked about the pulse when asked how should could take care further. Felt as I was getting nowhere, and that is that it was going badly. But speaking to other candidates, they felt the same. So here the rule care was so strong. So our task is that dexamethasone given 10 times more. So it is an apology scenario. As usual, I at CAP introducing myself, making the report, taking the consent, telling the agenda and any attendance and prior knowledge. I apologize on behalf of me and my team that there is a mistake or error occurred that we have given 10 times more the dexamethasone than is prescribed dose. Who did that? Mother is serious. Who did this? It is not a single person error. It is a series of events lead to this error. Who did this? Still insisting. We are still investigating into the matter. I want to know who did this. Still insisting. I'm not in a position to give you any names, and we are still investigating. But the good news is that the drawbacks not happened till now. So like that, we'll all medical error who tell this will always tell that is a not a single person's error. It is a series of events. Then we'll move that there is good news. There is no any drawbacks occur. According to what is the drawbacks of dexamethasone, we will tell that and what are the management steps we are taking. So we will monitor his blood pressures and blood glucose level, and if needed, we involve the tummy doctor and the gland doctor. So blood pressure and blood glucose we are monitoring, and tummy doctor and gland doctor will involve if needed. Then mother is telling that she needs to left this hospital, want to go another hospital. We are the best hospital for Ali, and he is familiar with the staff, and we are familiar with his conditions. If tell you you would be prevent me to take my child, of course not. But once he's stable, we'll discuss it with the consultant, and we'll do double check of the dose, and we'll add the fluorescent marker. We will tell that we are taking so steps. Further, this will not happen because we are taking the double dose taking, and we are adding the fluorescent marker. The mother complained that I want to complain. Then we will tell that I completely understand you're upset. It is totally your right. Already a critical incident forms has been fulfilled and our practice manager has been involved. Again, mom is still insisting to complain. Also, we'll discuss it in our weekly meeting and we'll update you. Also, complain then it is totally your right. I will guide you through the patient advice and liaison service. Then relax, calm down, take it easy. This type word we will use. Also, some lines like I'm totally understanding what you feel. I'm totally understanding why you are upset. Then the mother is angry, telling at the end, I do not want this criminal one to touch my baby. It is your right if we know the person who do this mistake, but actually it is not a single person error, it is a series of events. So never ever we tell that the name of colleague or someone we indicate, we tell that it is a series of events. It is not a single person error. So this is all about the dexamethasone medical error communications. Thank you very much.